a new study from accounting giant Price Waterhouse Cooper is getting a lot of attention after finding medical cost trends known as medical inflation is actually slowing down. And consumers and companies keeping a close eye on healthcare costs is a big reason why. Bertha Coombs has more.
Retail health clinics are relatively new in the U.S. 5 years ago, fewer than 1 in 10 Americans used one.
I go to Canada a lot, and I see all these clinics all over the place, and that's what people do in that kind of market.
But last year, 1 in 4 of us opted for a more affordable clinic at some point instead of our doctor's office or an emergency room.
I wouldn't use an emergency room other than absolutely necessary because I know how expensive it is.
Those kind of cost-conscious decisions are helping to drive down healthcare inflation, says PwC Managing Director Cece Connolly.
If you think back to, say, the early 1990s, the healthcare cost trajectory was straight up, double-digit increases year after year. We're now really coming down into the 4–5% range.
In a new report, PwC projects medical costs for the nation's largest employers and their workers will grow 6.5% next year, down a full point from their estimated 7.5% growth rate for 2013. Part of the reason is workers like Deborah Plossin are footing more of the bill.
Well, I feel like they keep taking more and more away from my benefits, more deductions, and they're paying less and I'm paying more.
Employers are also pushing back at providers like hospitals. Lowe's and others are opting to send workers to high-performance health networks like the Cleveland Clinic and Mayo Clinic.
These are places that employers are signing direct contracts with to do some of the most difficult cases that they might have. And because their outcomes are so solid, it actually brings down the cost.
PwC believes that this new cost-conscious trend among patients and payers is here to stay, and the taming of medical inflation will result in long-term savings. For Nightly Business Report, I'm Bertha Coombs.